My name is Uta Kiltz and I'm a rheumatologist from Germany, working in the field of rheumatologist for more than 25 years. My clinical work focused on every type of musculoskeletal diseases. I'm also a researcher doing most of the research in clinical research and focusing on spondyloarthritis and quality of care. I'm involved in developing recommendations since more than 15 years at a national and also at an European level. And now I'm the Quality of Care Chair and would like to move forward this field. The main goal of the Quality of Care Committee is to improve patient care in musculoskeletal diseases throughout Europe. And one basic principle in rheumatology care is a multidisciplinary approach, and therefore the committee is represented by rheumatologists, by a clinical researcher, by healthcare professionals and by patient representatives. Because musculoskeletal diseases are under-recognized worldwide and because there's a variety of different clinical disease pathways in rheumatology, it's very important to homogenize the management, the treatment patterns for patients with musculoskeletal conditions. And therefore, the main objective of the Quality of Care Committee is to develop evidence-based recommendations for the management, for the treatment of a variety of different musculoskeletal disorders. Clearly, the flagship of EULAR are the recommendations, and therefore it's very important that the evidence-based recommendations are consensus-driven and that the development strictly follow standardized operating procedure. Therefore, it's also important that the content of the recommendation can be transformed also at the national levels for the different EULAR countries, and therefore it's important to have an implementation strategy so that the recommendations are applicable at the national level as well. Although we try to identify the evidence behind every recommendation in daily care, it's also important to recognize that there are many unanswered questions, and therefore one important point is also to add all these open questions in the research agenda to stimulate the community to close this research gap. So EULAR recommendations are setting the standard for quality of care in RMD conditions, and to do so it's needed that we are working together within the EULAR community, meaning that rheumatologists, healthcare professionals and patients exchange the ideas, the knowledge and also research gap to improve the quality of care for rheumatological conditions throughout Europe.